So the next link in the chain that we're going to look at is the trunk. And with this, I consider the low back, mid back, and the neck. And we're going to take a look at how these things have to interact with each other. Some common compensation or dysfunctional patterns that I see with folks. One is an overextended spine, where when they go backwards, they do not have great loading tolerance on their joints. Oftentimes you'll kind of experience low back pain that radiates from side to side, sometimes down into the hips, depending on the severity. Other folks that have that extension sensitivity, they're maybe getting nerve root compression, and that can travel down into the legs. Folks that have difficulties with more flexion based, maybe they have either the bone or the disc is a little bit more sensitive to stress, so they're going to have more pain when they're flexing down. Or just overall tight muscles. They may be tight in all directions. They may be tight when we go to extend and they contract, but when we flex, they may also be tight and guarded because they don't want to extend and let go. All these things can kind of happen for a whole bunch of different reasons, but some common dysfunctional like movement patterns that I see with folks as I go back to stuff that we've talked about before. More of a wider base of support, externally rotated feet and hips, and that puts us in a position where we can't absorb shock very well. The feet and the ankles are kind of taken out of it. The knees and the hips are at a disadvantage, as well as the musculature that goes from the hips and up into the pelvis and the spine are not in the optimal place to actually do their job. For example, the hip flexors, when we're overly rotated out, they never get the ability to fully extend. And so what starts to happen is they start to shorten and become more irritable over time. And because of where they attach on the pelvis and into the lumbar spine, they become overly tight and overactive, and that starts to put compression stress into our back, starts to pull things forward a little bit. And we'll start to see people that can't move well through the hips and the spine because of that load or compression sensitivity. Going up into the next link in the chain there is our thoracic spine. Oftentimes you'll see with folks, because our world is so front-loaded dominant with the activities that we do, you'll see this rounded posture kind of flex forward, shoulders are rounded, and having difficulty with going into extension. Usually when people are a little bit more stiff that way, when they go to try and improve their posture right away, they have difficulties because the thoracic spine, the middle of the back, doesn't move well. So then the lumbar spine says, hey, I know how to do that really, really well, and I'm going to extend for you to give you the impression of improved posture. But it's at the expense of the low back. And so when we're working on these things, we got to make sure that we really kind of isolate the areas that we need to. And when I'm thinking about assessing people as well as exercise prescription, I'm trying to figure out, does the thoracic spine have the ability to move? Does the lumbar spine have the ability to move? And if so, how much? And usually the patterns that I'll see with folks is they're moving a little bit too much in the low back. Maybe they have an instability, but then they're not moving enough in the thoracic spine. So the lumbar spine or the low back is screaming out to them, when in fact the thoracic spine is not pulling its weight and being able to do what it needs to be doing. And then going up into the cervical spine or the neck. Oftentimes you're going to be getting irritations here because just like the lower spine, it's probably doing too much. If we're stiff and rigid in the middle, it's going to be more difficult to go through extension and rotation because it's not getting any help. So it's going to be trying to do all those different things. And as you go into extension, probably kinking back in here because the thoracic spine and our shoulder posture is not allowing for that full mobility. So when we're looking at people's movement patterns and thinking about prescription, moving forward with how to help improve either their low back pain, mid back pain, I'm trying to assess, am I dealing with just purely muscles? Is there maybe a joint component or a disc component? And then why is that area screaming out at us? Why is that not happy? Is there something above or below that's not doing its job that then is making that area talk to us? So now from here, I want to go ahead and move into how do we start to work on mobility, maybe even a little bit of stability for the low back, but also mobility for the upper and mid back.